Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Novavax from Roots Community Health Center, reporting for the week of June 6, 2022. After providing a local COVID update, including mask mandate updates, I will talk about new variants as well as a vaccine update to include boosters, new vaccines on the way, and some thoughts about what's next. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments by direct message or by email to admin@rootsclinic.org. So nationwide, we are still seeing cases on the rise. We are still losing, on average, 250 people per day who are dying from SARS-CoV-2 in the United States. Here in Alameda County, we take a look at the previous 14-day total cases. When I reported 2 weeks ago, we were at 8,619, and now we are up over 10,000 cases for the previous 14 days, and still not really seeing any kind of a peak just yet. Sharing the total daily cases, which normally aren't super helpful because they keep getting updated within the last 7 days, but they can be helpful when there's a clear pattern, and that's why I want to show it today, that even though we know that there's a lot of under testing or under counting of tests because people are testing at home, that even despite all of that, and then despite the normal lag in updating these tests, because you can see there it says incomplete data for the last 7 days, meaning that that's only going to go up from here. But even with that, you still see daily cases increasing. So definitely continuing to go in the wrong direction without really a sign that we've hit that peak yet. And likewise, when we look at the rolling 7-day percent of positive tests, when I reported 2 weeks ago, we were at 7.8%, now at 9.5%. So definitely continuing to head up. And I like the OUSD dashboard, but as we can see, the amount of testing is decreasing because, of course, school is wrapping up. So I'm not sure how useful this is going to be over the summer. Depends on how much testing they continue to do. But nonetheless, we can see that from when I reported 2 weeks ago at 3.1 positivity, we're now at 4.2% positivity. So once again, all signs kind of pointing in the same direction. And unfortunately, when we look at hospitalizations and ICU, there is a fairly concerning increase. I reported 2 weeks ago, there were 92 people in the hospital. Now there are 118. It's about a 30% increase in 2 weeks. And in the ICU, there was only 3 in the ICU 2 weeks ago, now at 13, so that's more than quadruple. So we'll continue to keep an eye on this. We are still looking good as it relates to hospital capacity, but the concern here is the trajectory we're heading and the fact that folks are still landing in the hospital and the ICU with SARS-CoV-2. And even by the CDC's community transmission map, you can see that most of California is now considered high transmission, and Alameda County is no exception, right along with all of the other Bay Area counties. And so I think all of this is pointing to obvious reasons for concern, and we can see that our public health officer here in Alameda County responded to some of this concern by reinstating indoor masking requirements. And that was effective this past Friday, June 3rd. And our public health officer, Dr. Nicholas Moss, stated that rising COVID cases in Alameda County are now leading to more people being hospitalized, and today's action reflects the seriousness of the moment. We cannot ignore the data, and we can't predict when this wave may end. putting our masks back on gives us the best opportunity to limit the impact of a prolonged wave on our communities. Well, I cannot agree more. I think this is very reassuring. Regardless of how you may feel about mask mandates or whether they work or whether they're right or not, from the standpoint of disease transmission, from the standpoint of our local leaders paying close attention to what is going on locally and making decisions accordingly, this is exactly what we've been asking for. We don't think that the CDC is necessarily going to know what to do in every single jurisdiction, and our local public health leaders do. And so I find this reassuring. I applaud it. One of the reasons that was cited in the press release, which the link is in the post, is that not only are hospitalizations increasing, not only are cases increasing, but our disparities are widening. So once again, this is very reassuring. This is how public health is supposed to work. Public health is supposed to protect the interests of the public and is supposed to have in mind and center the needs of some of those who are the most vulnerable. We still have vulnerable people, including all of those unvaccinated under 5, as well as folks who are vulnerable for a variety of other reasons. And we want to applaud this decision as being responsive and responsible. And when the data changes back, they can make a different decision, and I'm sure that they will. But I'd like to encourage us to not compare us necessarily to other places unless you have the full set of facts. There are certain facts that we are dealing with here in Alameda County that perhaps neighboring jurisdictions have a different picture as to vaccination rates or hospitalizations or health disparities. And I think it is good to know that we have the ability to not only increase protections when things seem to be heading in the wrong direction, but that should also be a signal and a message to all of us that it's too soon to let our guard down. The mask mandates were removed, and now they need to be reinstated to prevent too much of a worsening of the current situation that we are in. So definitely applaud that decision, and we'll keep an eye on any changes that are forthcoming. And I wanted to also talk about sort of the emergence of these newer variants, because certainly this is also a cause for concern as to the situation with transmission and with increased transmission, and why we may want to be really more vigilant about stopping spread at this point in time. I've been reporting now for several weeks on the new Omicron subvariant BA2 12.1, and that has been really replacing the BA2 strain of Omicron. Last time I reported it was at about 48%. Now it's at about 60%. And this subvariant is more contagious than the original Omicron, and it does a little bit of evading our immunity. But what we're worried about now is the BA4 and 5 subvariants. BA4 and 5 they're sort of at low levels in many different places, including here in the United States, but the rate of increase and the rate at which it appears to be displacing BA2 12.1 is rapid. And so it's looking like it's going to be outcompeting that BA2 12.1, and that BA4 and 5 are the subvariants that we are kind of watching at this time. And I put a link to a preprint, so we're still going to be waiting for this study to be peer-reviewed, but nonetheless, this is sort of emerging data on BA4 and 5, and what it is showing is sort of a little bit of a concerning resistance to prior immunity. So when they looked up the BA2 12.1, they found that it was about 1.8 times more resistant to people who've been, let's say, to their serum, vaccinated and boosted. So 1.8 times more resistant with the BA2 12.1 compared to the BA2. So we didn't like that, 1.8 times more resistant to our prior immunity from vaccination or boost. But when we look at BA4 and 5, we're finding a 4.2-fold increased resistance. So what that means is that these BA4 and 5 are not only more contagious, but what this means is that they're also more likely to break through our vaccine immunity, vaccine-acquired immunity. And it may stand to reason that it will also break through naturally acquired or infection-acquired immunity as well. And so BA4 and 5, more contagious. Not sure if that is because it's avoiding our immune system or if there's also something inherently making it more contagious or both. But there are some concerning mutations that we've actually seen before that kind of help BA4 and 5 escape some of our antibodies, and so it's sort of getting through our prior immunity. The good news is that our treatments, so far, our treatments seem to be able to hold up. So the Paxlovid, as well as one of the monoclonal antibodies, the one that we're using now the most, bebtelovimab. So the treatments are still effective. That is very good news. However, the risk of it evading our prior immunity is 4.2-fold higher with BA4 and 5 compared to the original Omicron. And so what that means is not only, could you get infected even though you're vaccinated and boosted, but also there's the risk of reinfections. And that is something that we are beginning to become more and more concerned about as people get COVID for the second and third time. And as we know, every time you catch COVID, that is an opportunity not only for a poor outcome, but also for long COVID. So we're wanting to obviously avoid infection and avoid reinfection, and that is getting more difficult to do with these more evasive variants. And so on the horizon, we have a couple of new updates. We will likely very shortly here have a decision on Novavax. Novavax is a protein subunit vaccine, so it's a lot like some of our flu vaccines, some of our older technology. It's a 2-dose vaccine. Right now, it's being assessed for 18 and older, although they are also testing in adolescents and for booster doses and other things, and so those will likely be presented later. But right now, sort of as we speak, the VRBPAC, which is the advisory committee to the FDA, is deliberating, reviewing the data on Novavax. They have submitted their briefing documents. The link is in the post in case you might be interested. It is an 80-page document. I have not gotten all the way through it yet. But in general, the efficacy of the Novavax vaccine is looking to be around 90% against symptomatic disease. And they're doing a very large trial. It is in over 119 sites in the United States and Mexico. And so far, the efficacy looks very good. And we are also waiting for more information about how it does against all of the different variants. But it does seem to be mounting a bit of a broader response. And so we are hopeful that it is going to be able to hold up well against all of the different variants. And so far, that is looking to be the case. So we should have a decision usually after the FDA approves, then the CDC usually moves fairly quickly to approve as well, although they could decide to deliberate. So we will be keeping an eye on what's going on with Novavax. It's not clear just how many doses the U.S. government is going to order once the vaccine gets its authorization. They're going to decide that after FDA authorization. But from some of the press briefings, Novavax has received $1.8 billion from the government under Operation Warp Speed, which would enable the delivery of 100 million doses. So once again, we will see how all of this pans out very shortly. And as a reminder on boosters, I'm still getting a lot of questions about the booster. The first booster is recommended for everyone 5 and up now. So everyone 5 and up can get that first booster, which is a third shot for most people. If you're immunocompromised, it's a fourth shot because remember, for immunocompromised, the primary series is 3 shots. So first booster is recommended for everyone 5 and up at least 5 months after the primary series is complete. And a second booster is now recommended for everyone 50 and up and everyone 12 and up with immunocompromised at least 4 months after the first booster. So this will be the fourth shot for most people. For those who are immunocompromised and needed a 3-dose primary series, this would be their 5th shot. The CDC came up with this handy tool, and the link is in the post. And so if you want to know if you are eligible for a booster or due for a booster, you just come here, get started, you pick the age, answer a couple questions, pick the vaccine that you got, and it gives you the recommendation. So that is a nice, simple, and easy tool if you are so inclined. Another update is regarding vaccine dosing after you've caught COVID. This could be about the primary series if you haven't gotten that yet, or even about the booster. And what I think is most important about this is that there is growing evidence that says that even after you get SARS-CoV-2, getting the vaccine is going to provide substantial protection from another infection, that reinfection I was talking about, and hospitalization, and that this includes giving additional protection in light of all these new strains. And so what we're seeing is that oftentimes the prior infection is not giving the level of protection against new variants that we're seeing with vaccination. So even if you've been infected with SARS-CoV-2 and you're due for, let's say, your first shot or your second shot or your booster shot, that essentially that is still recommended, but there's some changes into how that should be done. So first off, as we've always said, you should wait to get any vaccine until after you've recovered from your illness, if you had any symptoms, and also that you have cleared your isolation period. So you're done with isolation, you're not contagious anymore, you're feeling better. And what the CDC has said, the new part is that people who have had a recent SARS-CoV-2 infection may consider delaying a primary series dose or their first or second booster by 3 months. So this is much longer than what was recommended before. And this is based on 2 things. One is that there's studies that have shown that increasing that time interval between infection and vaccination may result in an improved immune response to the vaccine. And so that makes sense, and it's kind of goes along with what I've been mentioning here, which is that the primary series spacing has also increased. So now we're talking about 8 weeks between the first and second dose for most people under 64. Same reason. We think that increasing that time interval is giving an improved immune response overall. So in the case of having had a SARS-CoV-2 infection, increasing that time interval up to 3 months might give a better immune response to the vaccine. And also it's based on the fact that the risk of reinfection is fairly low in those weeks to months following the infection. So this does need to be individualized. If you have risk factors for severe disease, or if the community levels are just really high, or if you need more rapid protection for some reason, these are things that should be kind of individualized with your provider, with your primary care provider. But I thought it was important to mention this difference of how to approach the vaccine post-COVID infection. And definitely don't assume that that infection is going to give you adequate protection. We still want you to meet the definition of being fully vaccinated, but you may be able to prolong the interval and therefore give yourself some better protection. And also, I think that I'm hoping that we all know this already, but you don't need to get tested after infection to see about getting vaccination or to drive decision making about vaccination. We can go ahead and wait the designated period of time, and that will suffice. And just a quick note on our under 5-year-old vaccine. We could have approval before the end of the month, as soon as the 21st of June. The ACIP will have a 2-day meeting on the 17th and 18th of this month. I'm not sure when they'll be deliberating and making the decision, but that will be forthcoming, and we should have the agenda for those meetings fairly soon. So in terms of what is next, so mention the Novavax, mention the children's vaccines. We do have 2 evolving situations that we are monitoring, ongoing investigations about the hepatitis outbreak in children, as well as the monkeypox outbreak that is occurring in multiple countries around the world. The only thing I'm going to say about monkeypox at this time is that if you have an unusual or unexplained rash, please do present to your primary care provider or clinic and have those looked at. If they are suspicious at all for monkeypox, they will take some samples and send them off and treat accordingly. But I wanted to mention that many of the images, I'm not going to share them today, but they don't all look the same. They don't always have to be these gigantic sort of blister-looking things everywhere. Some of the images that we've been seeing of some of these cases actually can be more localized, and they can be different sizes. They can be a little bit smaller. So don't want to alarm anyone, but we definitely do want to get ahead of this. I think the key to us staying ahead of this is quickly identifying it and quickly getting folks to isolate, and also the contact tracing. And the good thing in this situation is that if we're able to contact trace, that we can actually administer a vaccine within enough time to actually prevent the contacts from getting it. So imagine if we had that with SARS-CoV-2. We never had enough time to get ahead of SARS-CoV-2. Does not appear that that is going to be the case with monkeypox, no matter what, is that it's not as fast moving. And we also have the opportunity, because it has a long incubation period, we have the opportunity to actually stop it from happening if we know that there's been exposure. So that means that the burden is on all of us, individuals, as well as healthcare providers, to be on alert, to be able to detect this and to act accordingly. And want to, in the meantime, just remind us all that we are still in an active and ongoing pandemic. Unfortunately, we have not reached an endemic state yet. The pandemic is not over. And in some ways, it's getting harder to really assess where we are. And that is why I think it's becoming more and more critical that we know that our local leaders are paying attention to what's going on right in their backyards and making decisions accordingly. So we hope to see more of that. And in the meantime, each and every one of us needs to do our best to slow transmission, and that means wearing a mask, because if you might have COVID, you might be contagious, you might be pre-symptomatic, asymptomatic, you might be at the end after your 5 days, and you might still be contagious. So we're wanting to test if you don't feel well, wear a mask. That is going to be source controlled to keep you from spreading it around to other people, and it's also going to give you protection. And the most protection it's going to give you is if you are wearing a high quality, high filtration mask. Especially important if you're the only one masking. Two-way masking is, of course, the safest, and which is why with these indoor mask requirements now, we'll have two-way masking, so that is going to substantially reduce transmission. Outdoors, much safer than indoors. If you must be indoors, a shorter time is safer than a longer time. Don't linger too long. And don't forget to increase ventilation in any way that you are able to. Open doors, open windows. You can even monitor your air exchange with a CO2 monitor if you are so inclined. And to prevent the most severe and tragic outcomes of SARS-CoV-2, vaccination and booster are still remarkably effective at preventing the most severe outcomes and death. And we don't want to see any more deaths from SARS-CoV-2. I think we should be going for 0 COVID deaths, and we should be asking questions if people die of SARS-CoV-2. What happened? Did we get treatment in time? And that should really be our goal. If you catch SARS-CoV-2, you are a loved one, especially if you are in a high-risk category. And the link to that list of high-risk categories is in the post. Please ask your primary care doctor about it. Advocate for yourself, advocate for your loved ones. Time is of the essence, and most of these treatments need to be started within 5 days, but certainly the sooner the better. Gives you more effective treatment and better chance of keeping you out of the hospital or worse. And so make sure that you know how to reach a primary care doctor, get all of your other things checked out, eat a balanced diet, get some exercise, manage your stress levels, and consider a multivitamin supplement with additional vitamin D, and get a good night's sleep. Thank you so much for joining us. We'll see you again next Tuesday at 10 a.m. See you then.